Hello, I'm Dr. Brandt Gibson, and I've been talking with multiple peripheral neuropathy patients, and there's clinics that they will go into and they will get this treatment, then this treatment, then this treatment as part of the regimen to treat their peripheral neuropathy. And the question that comes out is, can you overtreat peripheral neuropathy? Can you make the problem worse by treating it over and over and over again by different modalities? So there's really two answers to this question, and it depends really on what types of treatments are being done. So to take a step back, let me give you a little bit of background so you kind of know where we're coming from here again. So when you're treating peripheral neuropathy, you've got really 5 different options on what you're trying to do. Number one, you could say, I'm doing this treatment to repress the pain, to repress the symptoms. Many of the medications that are used for this, that's really their purpose, is to repress the nerve symptoms so you can sleep better at night and so forth. That's one of those treatments. Number 2 is to reset the nerves. Where you say, okay, I'm going to depolarize and repolarize to make the nerves function like they're supposed to. Number 3 would be to re-educate the nerves, to get the nerves to function like they're supposed to, where you're actually teaching them to communicate correctly with the brain. Number 4 would be to repair the nerves and help the nerves function like they're supposed to. And number 5 would be really to say, okay, I need tools that I can actually release it so that it becomes less of a problem or less of an issue. So all of those can be valuable treatments. And some of them can be stacked. Sometimes you can use them together. Sometimes you cannot. Now, the question is, if you were to do 2 of them that were designed to repair the nerves, for example, would that be beneficial? If you were to say, okay, I'm doing different types of electrical stimulation, would that be beneficial? And so forth. So let me give you an example. I have patients that come into my office and they go through a process of MLS laser, which is designed to decrease pain, decrease swelling, and stimulate healing. So this is designed primarily to repair the nerve. But sometimes, as you're in the process of repairing that nerve, you will increase symptoms, you will increase pain. And so some of these individuals will likewise go through the laser, and then they will go through a treatment that's designed to re-educate the nerve called Calmare, where it actually decreases their pain at the same time. So is this beneficial? Yes, these can be used together because you're treating the nerves in completely different and separate modalities. But what one is designed to do is not to decrease the pain by repressing it. It's not designed to decrease the pain by resetting it. It's just as the nerve is healed, as it's working more correctly because of the laser, it's also causing those signals that are working now to communicate correctly with the brain. So it's modalities that can work in conjunction with each other to get the nerve functioning even better. So those 2 treatments can be stacked. The process of stacking is taking one treatment and doing it, and then putting another treatment on top to also do it. Other ways that you can stack, if you say, okay, I'm going to stack nutrition and vitamin modalities and one of these other treatments, those could all be stacked and they will work together in repairing the nerve and helping the nerve function more like it's supposed to without over-treating the nerve in the process. Now, let me give you a different example. Say you're coming in, you say, okay, I'm going to do the laser, but I'm going to also do a form of electrical stimulation similar to a TENS unit. Can this be a problem? In some cases, the answer would be no. In most cases, the answer would be it very well could be. Because what's happening is you're saying, okay, I'm treating the nerve to heal it, and then I'm overstimulating it. So I'm getting this nerve to start to improve, and then I'm stimulating to repress the pain, for example, or repress the symptoms, for example. This overstimulation can actually make it so that you will have an increase in symptoms or increase in problems from the nerve. You can overtreat a nerve. So if I were to say, okay, I'm going to, usually when I do laser, I do it for this amount of time. I'm going to double that. The MLS laser, if you were to overtreat the nerve, can increase symptoms because you're not giving it the recovery period or the recovery time to actually allow that to get better. So again, you need to be very careful when you're going through treatment modalities when you're treating your peripheral neuropathy to not overtreat the nerves. If you're doing treatments, you're going through this process and you're saying, okay, I seem to be getting a little bit more tender after the treatments, or I seem to have more symptoms. One of the questions to ask your doctor is it possible that I'm overtreating these nerves? Because there is a good possibility that if you're doing a form of electrical stimulation, say a horizontal therapy to your nerves, and you're doing the MLS laser type treatments to repair the nerves, and you're saying, okay, I'm going to do infrared light therapy, you may absolutely be overtreating the nerves and can cause increased symptoms. You can cause further malfunction of the nerves, maybe by overutilizing the neurotransmitters. All of these can play into it. So be very, very careful when you're doing stack therapy to make sure you're not producing more symptoms in the hope of improving your nerves. A lot of times I recommend that you try single treatments or maybe one or two together and not a whole bunch of them together, because you will usually find that as you throw multiple things at it that are all modalities, machines that are being used on you, for example, that you will have less beneficial effect because of all of that treatment. This is Dr. Brandt Gibson, and I'm thankful that you're here and listening. If you would like additional information, I'm working on a process so that you can go through and evaluate your peripheral neuropathy and determine what the best options for you, so that you're not just doing the shotgun approach or say, let me throw all of these things at it and hopefully one of them will work. You can say, I'm going to do this treatment because it's going to work, and I'm going to do this treatment because it's going to work.